So this is part 2 of the IRB application for overview for DNP students doing their DNP projects. And so the first part looked at the application and how to add individual team members to this application and their certificates. So once we come down here, I'm going to delete all of this here. So under the IRB application, this is a little bit of how the IRB is going to review your application. And so it's important to make sure that you're putting in the right things here. So the first one, you just click in the box here in terms of application type. This is going to be a new application. Now keep in mind that when you are done with your project, you're going to submit a final report, which will just involve copying and pasting or uploading your final paper or parts of it. But we're going to do a new application here. The purpose, in this case here, they don't really have, we could call it dissertation. I don't know if it's the best. Probably the best thing here is thesis at this point. It's not really a thesis, it's a project, but we can go ahead and do that. Now, under here, exempt, expedited, or full board review. I want to go over these 3 different types of review. I'm hoping that no one will be doing a full board review. That means that there is moderate to high risk to your participants, and you should not be doing clinical trials of a drug or a procedure or anything that could potentially harm the participants in your trial. So should be in all cases either be an expedited review or exempt. Let's talk a little bit first about exempt. There are, when we look at an exempt review, generally in these cases, they really don't fall under the definition of research. So if you were truly doing a system level intervention and you were collecting system level data, just a quick example. Your unit has decided to implement a new protocol for reducing the incidence of catheter-acquired urinary tract infections. Again, this is more of an acute care, and most of you are doing primary care focuses, but kind of an easy example here. And you are implementing a protocol across the unit. Everybody's going to be getting the same all the nurses are going to get the same training, patients are going to get the same treatment. You are going to look at CAUTI rates for 3 months before and then 3 months after. So there's no identifying data. This is data that your nurse manager and the other, maybe your CNO, would acquire anyways for reports, for accreditation and things like that, for CMS. And in that case there, it's really not research. It's a quality improvement project. And so under that case, it would be exempt. Let's go back here, if you are accessing chart data, if you are doing interviews or surveys with patients, it starts to kind of get a little bit more into the research realm, which is okay for your project, but it probably won't be qualify as exempt. Exempt gets the lowest level review. The staff will look at it, and if they make that determination that it is exempt, usually gets approved with often, in some cases, a few days, if not a week. My record was 2 days. Expedited means that it's minimal risk to your participants. And in most cases, the biggest risk is maybe loss of confidentiality or privacy. You learned about that in your city training. So again, if you're unsure, if you're doing more of a protocol with some education, even if you're collecting some survey data maybe from the staff, but it's anonymous, in that case, put exempt. If it doesn't qualify for exempt, then the staff will get back to you and say, this doesn't qualify for exempt, it's going to be expedited. They'll ask you to kind of update that and change a few things, but that's it. So one of the two, hopefully. Let's go with expedited for now. Then under attributes, we're going to put not funded. Funded means that you have a grant from an external agency. So then we just have to kind of pop in here. Other purpose, we shouldn't need to do. Funding source is none. Funding agency would be none. Again, you just kind of click on the box and you get a list of potential agencies. Other funding source, we won't put in. Sponsor means sponsor of funding. This is all here about funding. Now, this only section here under IRB required information that you will have to fill in is the C6 review categories. And this is where you actually have to go in and you have to list one or more of the exempt or expedited review categories. So let me walk you through these. So the way to get it is you just hover your cursor over review categories. And if it doesn't come up, scroll around a little bit or reload the page or use another browser. Sometimes it's a little picky about what you use. And then let's go under exempt first. So we're gonna click on this link. It's gonna bring us to an IRB page, an educational page. And we are gonna click on this little link down below, categories of exempt research activities. Now, I'm actually going to post this on Canvas, so it should be there for you to look at as well too. But these are the different categories of exempt, and most of the ones that may qualify, that kind of hover around, that are DNP projects, is probably number one. Even though technically we're not doing this research or these projects in an educational setting. A lot of times there's a big educational component, a training component, and it's something that you would do for staff education even if you weren't doing your DNP project. And then, yes, you're assessing it, and maybe you're looking at some system level data to show the effects of whatever that training or education was. Again, keeping in mind your DNP project has to be more than an education session. But maybe you're implementing a system change, but there is a component where you're actually going in and educating the staff and about it. So one could be a category that you might, if you think it fits in there, research in establishing or commonly accepted educational settings, i.e. a staff educational setting. Research that includes only interactions involving tests, surveys, interviews, public observation. These have to be, for the most part, anonymous. They have to be low risk. If you were doing something on sexually transmitted diseases and interviewing individuals, even if you were keeping it anonymous, if there was any risk of privacy breach, then it's probably not going to be looked at as exempt. It says here may not include intervention, only include interactions. Now, when they talk about intervention, they mean about an individual intervention, not necessarily a system intervention. Because system intervention is something that you do system-wide, not just to the people necessarily who are in your, being your participants or part of your evaluation. And so two could work as well too. The key thing here is that under number two, if you are involving children in any way, you're probably not going to be able to have an exempt study, and you'll have to go hopefully expedited. And so you can see that in red here, no children, no children, no children. And down here under 3, it says may not include medical interventions. And so if you're doing anything that has, so for example, the study kind of research project, kind of research, kind of quality improvement that I'm doing on a rehab unit at a hospital is that the physical therapists are going to be implementing a non-pharmacological intervention to try to reduce post-operative pain. Technically, it's a medical intervention, so it's probably a little bit on the edge since it's non-pharmacological, but it really is a healthcare related or medical intervention. And so I decided not to go for exempt status. I'm going to go for expedited because of this particular requirement here. Anyways, research involving benign behavioral interventions. And so if you were doing something to try to change behavior in diabetic patients and how they're managing their diet or their glucose or something along that lines, then you may be able to meet the requirements of exempt category 3. Okay, and then for secondary research, so you're probably not going to end up under this. This is where there's already data collected and we're analyzing it. So that tends to fall more in the research category than QI or EBP projects. And same with 5 and 6, chances are none of these are going to apply to you. So look at 1, 2, and 3 and talk to your chair. And if you think you meet one of these, then you can put that on your IRB application. So you would come over here and let's get rid of this here. If you click on this, and I think I'm, 2, exempt category 2, then we would just put that there. The other option, let me go back, and here we are under expedited. And we scroll down, and they have the expedited copies just listed on this web page here. So let's take a look at them. Number 1, clinical studies of drugs or medical devices only when certain conditions are met. Now, we are not doing any of that, likely. This becomes a little hard to meet just because if you're really implementing a new medical device, it probably needs FDA approval, and there's a lot of rules around that. Collection of blood samples by finger stick, let's see, heel stick. Again, in a lot of cases, I don't think you will be drawing blood, but if you were and it was just by finger stick or venipuncture, it looks like they consider that fairly low risk, again, depending on the type of patient. Again, probably not going to apply to us here. Biological specimens, again, we're probably, unless you're collecting saliva samples or something like this, which again is more research than EBP, then probably not 3. So here's, if you were if you didn't meet exempt and you were going for expedited, chances are 4 is going to be the category that you might end up being under. So collection of data through non-invasive procedures. So no general anesthesia, no sedation. This could be, just surveys or interviews, but you're looking at or chart reviews, and you're able to. But you're looking at patient data, so there is again some risk of violation of privacy or confidentiality, but. But nothing terribly invasive, like you're not doing a clinical trial on a surgical procedure. And so 4 may be kind of the best thing. 5, research involving materials that have been collected. Again, this is more research. Number 6, collection of data from voice, video, image recordings. Again, some of you may end up doing something like this, so 6 may apply, and you can actually apply or have more than one category apply. Research on individual or group characteristics or behavior, cognition, motivation, identity, communication. If you're doing some kind of survey about attitudes or beliefs, 7 might be a good category for you. And then 8 is continuing review of research, so that's not going to apply, neither is 9. So 7 is a possibility, 6 maybe if you're looking at voice, video, audio, image stuff. Again, a lot of that is not often project work but research. 5 is you're collecting stuff for non-research processes. Again, that becomes a little trickier. So certainly 7 is probably going to be the most common one. So I'm going to go ahead and close all these up, and we'll come back to our application. We would choose, again, they list all these review categories. You don't declare. We've already declared exempt versus expedited, and then you pick your category here. So if I think it's going to be 7, it's expedited, then that's all I have to do. Okay. All right, I'm going to stop this recording here, and on the next one, what we'll do is talk about the main, kind of the main body of the application, and a lot of that is going to be, as we save here for a second, a lot of this is going to be copying and pasting information from your PowerPoint or any other written material that you've done to describe your proposal into the IRB application. So that'll be part 3.